Welcome to another episode of Medical Facts. This time we're going to talk about things to make your doctor visits more efficient so you don't spend half the day there trying to get to see the doctor. Hey everybody, this is Natalie, clinical manager of our practice, and we want to talk a little bit about why people miss their appointment times. They have a 1 o'clock appointment, maybe they don't get seen until 2 o'clock or 3, or why they end up having to spend a lot of extra time in the office, more than they anticipated sometimes. It's a very common complaint among patients, so we thought it would be a good idea to make a video to try and help patients know what they can do to minimize their time in the office and improve the benefit they get from their clinical visits, so that time is not wasted on things they really don't need to waste time on.
At the time of scheduling your appointment, you can always ask the scheduler as well what days are the busiest in the clinics. Usually that ranges from a Monday or a Friday, and you can always ask for the earliest appointment in the day. So just because Monday and Friday tend to be the busiest days, try to get maybe midweek.
And why would it be important to get an early visit during the appointment time period?
The earlier that you come in, probably the better, because everybody tends to show up at the end of the day or at the end of the clinic time. You have a better way of getting in and out if you get the earlier appointment.
And if we get delayed for some reason because the case is more complicated or there are gaps in the schedule that get made up in a hurry, the sooner you come in, the less likely it is that we're already behind on the schedule at that point.
Correct. Making sure your pre-registration is done and all your paperwork is also a big one.
And our patients, more and more, it seems like there's a long list of survey questions, medical history questions, symptom questions, in our case, sleep apnea screening questions. This all takes a lot of time if you show up unprepared. And while you may have a 1 o'clock appointment, if you show up right before the appointment, you haven't done any of this, in some cases it may take you an hour, and you may not even have access to all the answers that are there. So much better if you can do this before. How is best that they go about getting these forms and getting it done?
Depending on, it's the practice discretion. Some people are still using paper, some are more electronic. Make sure that we have updated whatever clinic you go to, they have an updated phone number and email for you, because there's always an email option, text message, or sending them through the mail. But it's always best to get it done before you come in, because it does take a long time when you come here.
Patients that have HMO style insurance need to get their authorization and referral from their primary care doctor before the visit, or they cannot be seen.
So there is a couple things that when you come in to see any doctor, for example, having your ID and insurance card at the time of the visit.
What is a CoPay, and why is that important?
CoPay is all varies on the insurance that you choose to have. We always like to tell everybody, before you sign up for an insurance, make sure that you really look at, your deductible, your out of pocket, and all of that, because with insurances and the contracts that most companies have, we are required by law to collect that copayment at time of visit.
And the amount of the copay varies. I know sometimes people think we're mean because we collect copays, but these are generally contracts that we have with the insurance that are intended to prevent frivolous visits. But if we don't collect the copay, it's a form of insurance fraud, because it's as if we are bribing the patient to come in and utilize their insurance benefits. So we really don't have a choice in that matter.
Correct. Making sure any previous records, if you saw another specialist or if you had any blood work done, to make sure you bring that in, because that is an extra step that you take once you get here into the office.
And what about things like medication lists? That's something we have to have updated in our records.
That is a big thing, because when you do come in, and especially if you're a new patient, for us to be able to start you on any new medication, we are going to need to see what you're currently on, if you're allergic to anything. And that's something that most of the time when patients come in, they're not aware of what they're taking. So if you can make a list or send it to us prior, it will be very helpful for your visit. And then make sure you have a list pre-made of any issues that you may have. Try to keep it between 2 or 3, up to maybe 4 issues. Remember that it's very mindful that not everything will be addressed in your first visit, but at least your main concerns, you can bring them up.
And what about the patient that says, well, I had a 15-minute appointment at 1 o'clock. Why is my appointment late? Why did somebody else get to spend 30 minutes? Why do you suppose that happens?
Now, we always explain to the patients that everybody's care varies. You know, some cases might be more complicated than others, but a big thing is that that's why we said bring the list and make sure that you kind of stay on topic so that way we have a fair amount of time with each patient.
Yes, I think most practices, we're not watching the clock so much when we're in the room with you. We want to deal with the problems you came for, or at least the important ones. We can always put some things off to future visits, but if you come in to find out for the first time that you have cancer and we have to explain the diagnosis and the steps to be taken, all this is not something we can do in 10 minutes. While somebody else is just a sleep apnea follow-up, maybe the whole visit only needs 5 minutes. So it's done customized to what the patient needs at that time. And therefore, the exact time that your next patient is going to be seen may vary.
Yes, that is very correct.
Well, thank you very much. I think that'll help people a lot, especially knowing about how important the time of the appointment is and coming to the appointment prepared so that you don't get here caught without your papers trying to fill in the gaps of memory. It's surprising how many people come in with a 1 o'clock appointment and they're not available to be seen for an hour and a half just because of time spent trying to remember what to put in their paperwork.
Yeah, definitely. And remember, and this can be used in any clinic that you go to just to make your process easier for yourself, the staff, and the provider you're seeing.
All right. Well, thank you very much. I think that's helpful.
Thank you.